Hi guys, I'm Maylin Dovan, certified athletic therapist and founder of Rehab-U Movement and Performance Therapy, and we're going to talk about how to build resilient hips. If you've seen my previous capsule on how to build resilient shoulders, there are requisites to having resilient joints, shoulders and hips. Ideally, you focus on mobility and stability first, right? So you want to make sure that you have optimal hip mobility. You want to make sure that you have optimal stability. With the hips, you're certainly looking at above and below. So you're certainly looking at, do I have appropriate lumbar, spine stability? Do I have appropriate stability at the lower levels, foot stability, ankle mobility, knee stability, etc. There are also positions that you want to strengthen and work in endurance. So a lot of the times our hips move into a lot of sagittal plane movement, so we get a lot of flexion and extension. We're doing squats, we're doing lunges, but we're not really working into our rotational ranges of motion, or at least not into a lot of range and not with very much control. I think it was Dale Buchberger once that said something like, the hip has a rotator cuff too. So as much as we work on the shoulder, we should work on those movements for the hips too. So here are a few movements that I like to program for building resilient hips. So either for prehab or, sometimes the stuff I use in rehab becomes stuff that I know if it works to fix an injury, it can work to prevent one. So it can fill a gap that people have within the capacity of their joints to build resilience. So first is an airborne squat. So we're gonna do a nice and controlled airborne squat. So it's a hip dominant movement. He's letting the torso come forward. He's letting the hips shift back and not just letting the knee drop forward. So we're gonna get him to slow this down. He's gonna go 3 seconds down, 2, 3. He's gonna go 3 seconds up, 1, 2, 3. 3 seconds down, 2, 3. 3 seconds up, 1, 2, 3. So the eccentric control, the single leg position, working barefoot is ideal as well. So I'm really getting that stability and strength in the hip, isolating really that movement in the hips. We want to work the rotational component of the hips as well, and this is nice because it also gives your knee a little bit more degrees of freedom. So again, the knee is a stable joint, right? It mostly moves into flexion and extension, but there's a bit of rotation that goes on in there. There's a bit of valgus stress, a little bit of varus stress, and the knee needs to be able to tolerate that kind of stuff if we want to be resilient. So these exercises, yes, will work rotation through the hip, but we'll also put some stresses on the knee that's likely to build more robust knees. So we're gonna have Frank do a lateral lunge where he glides the foot laterally as far as he can out and comes back nice and slow. And now I put no constraints within this movement. So he can turn his torso either which way he wants to get his foot as far out as he can. So he doesn't have to be in a straight line. He can turn the torso. Really what we're trying to do is get the hips to rotate and then to create movement in that rotated position. So we're not constraining this to a sagittal plane of motion. Glide. And then we're going to have him do the opposite. We have him glide across and behind. And again, no constraints to where his torso goes. I want some torque in the knee. I want some torque in the hips. I want him to have to move out and then bring that right hip back in front. So he's getting on that left hip some abduction, he's getting some extension, he's getting some internal rotation. It's almost like doing a PNF pattern for the hip, standing up. So when he goes the other way, when he slides out, he gets, the other way, sorry. Sliding out. No, out, yeah. Yeah, so when he goes this way, good. He gets extension. Perfect. Okay, so we're working within that multi-planar range of motion of the joint. We get some flexion, we get some extension, we get some abduction, adduction, we get some internal, external rotation, and that's what we want to do. We want to preserve as much of that mobility as we can. We want to work within that mobility as much as we can, so we have strength at those end ranges of motion. So we can't always be putting constraints where it's just a little bit of torque and it's all flexion, extension. We also want to work where we're torquing it out of into internal and external rotation, into abduction and adduction. That's how you build resilient hips.